Proudly brought to you by Lagos Traffic Radio 96.1 FM. It's our 13th anniversary right here on Lagos Traffic Radio 96.1 FM, and was still in that celebratory mood. Feel free to join the frenzy as you call in. Also, it's the last week of the month of May, and today's show is special. It's our open mic day. You know what that means, right? In this month of May, we have focused on common eye problems like presbyopia, ptosis, pterygium, and photophobia. We also discussed their causes, symptoms, treatment, and preventions. Today being our open day, which certainly means that you're at liberty to call in and ask your eye-related questions, or offer your views or contributions on these topics highlighted in the month or previous eye health topics discussed on the show. It promises to be very, very interesting, and you can get ready to call in and join the conversation. My name is Ataiwo Barua, standing in for your usual host, Akan Osen. Okay, so we have some fresh report from the control room. Quickly, let's run through some of them before we get down to business this afternoon. I have the optometry in the house, but let's tell you that within Ojo this evening, it's a very good one from Agbara Custom Checkpoint to Yanuera, and smooth vehicular movement from Yanuera to Yano Isashi. Looking very good. Proceeding to Afro Media, Yanoeba, Volks, you have better movement. Ascending Yanoeba flyover in Woodmao 2, it is a jolly ride, while underneath the flyover in Wadigondo, it is also good. Volks to Trade Fair, Abaliado, Posterben Carriageway, and the service lane, motorists are having a good time navigating that area. All right, our in-house doctor on the show this evening is Dr. Standing in for Dr. Priscilla Imade. We have Dr. Aderibigbe, Emioluwadamisi, an optometrist with Modern Eye Foundation. Good afternoon to you.
Hello, good afternoon.
How are you?
Fine, thank you.
Good to have you in the studio.
Thank you very much.
All right, then. In the course of the month of May on the show, of course, this is my second edition, of anchoring the show this month. So it means that there were 2 editions before I anchored the show last week. So I actually mentioned, some of the topics discussed this month. Can we have an overview of what has been discussed on the show so far in the course of this month? And there's some other things that you think Lagosians and Nigerians alike should even get to know, or, should be well informed about as it concerns eye care.
Okay, thank you very much. So, during the course of the month, we've talked about topics like photophobia, ptosis, pterygium, presbyopia. They're the P's. Let's call them that way.
The P's, right? I was going to say that.
Right? Okay, so basically these are all eye conditions that persons or people experience from time to time. So while we are answering the questions, I will still explain some of these things, because I'm seeing some questions that have to do with these topics or these conditions I have called right now. So ptosis is the drooping of the eyelid. It covers part of the cornea, the iris. Yes, so sometimes it can be very much where it covers the eye a lot that vision is blocked, like covered. Yes.
Okay.
So that's ptosis. We have pterygium, which is a fleshy growth on the conjunctiva of the eye, usually nasal. So we have presbyopia, which is an aging condition that comes usually from age 40. It can be earlier, which is pre-presbyopia, or it can be later than 40. But then it's when it's difficult to do near text or read small print without the aid of glasses. So that's presbyopia. And a lot of elderly persons, or not even elderly, even you see people 38, 39, 37 already experiencing symptoms of presbyopia. So we have photophobia, which is also known as light sensitivity.
Okay.
And then there are different reasons why one can have photophobia or present with photophobia. So It's just to know exactly what it is and treat the underlying condition. So all of these things you would be able to address when you go to the hospital, the eye clinic, to have your eyes checked. Yes, so that's it basically.
All right, then. Aside from this one now, is there any other one that you think Lagosians should get to know? Because I know last week we talked about photophobia, and I'm trying to look through my notes now. There was a question I was trying to ask Dr. Imadi last week. I'll just try and look through now if I can get hold of that question, because we talked about, sensitivity. I like, okay, we're talking about somebody coming from outside where it's sunny, and then you get inside the house or somewhere where, in a darker room, and then your eyes get a bit blurry, right? You can't see almost immediately, and then the doctor was saying, okay, so this only takes about seconds, just a few seconds, and then it goes back to normal. At what point should one see a doctor? Is it normal?
Okay. So yes, it's actually normal. When you go to a place that is very bright and you enter a dim room, there's something called light adaptation. So your eyes have to adapt to the new illumination that's in the room. So it can be a dim, yes, mostly dim. When you come from a bright place, you enter into a dark room, you have to undergo that adaptation process, and then it usually takes seconds. Yes, 60 seconds, your eyes are already back to normal. You're able to even pinpoint the things that are inside the room normally, yes, even if it's in a dim room. So it's actually normal. It's a normal thing. Light and dark adaptation has to take place here. So that's it.
All right, Lagos, Nigeria, you can be a part of a conversation this afternoon. Should you have any concern with your eyes and you have a question for the doctor, you can put a call through on 0915 387 7127. 0915 387 7127. Let's know what your concerns are concerning your eyes. As a driver, you have no business on the road if you do not have, good vision. So it's important that you pay attention to that part of your body.
Okay, so with me, I have some questions that have already been sent in. So I'll just be taking them one by one and explaining as we go through. All right, so the first question, this is from Mama Chinyere from Ajegunle. She says, good evening, doctor. One of my eyelid is falling down and covering my eye small. Please, what can cause that? Okay, so ptosis is the condition that you're experiencing, ma'am. So ptosis, like I had explained earlier, is a condition where just as you have said, the eyelid is covering part of your eye. It's drooping. That is the English, drooping. It's falling, like some persons will say. And then there are so many things that can cause this ptosis from taking place. It could be
Dr. Aderibigbe, let's take this call.
Okay.
Hello? We lost the call. Please put your call through again. Go ahead.
All right. So one of the things that can cause ptosis is when there is a nerve or muscle problem. Okay, before that, first of all, you will ask yourself, or we would ask you, is that condition just occurring? Is it something that just recently took place, or has it been like that for as long as you can remember when you were born? Because there are different types. It could be congenital, or as I was going to say, it could be as a result of nerve or muscle problem. Now, this nerve or muscle problem could be as a result of trauma to the eye. You were hit in the eye. It can cause that condition to take place. It could be as a result of maybe a tumor that is growing at a part of the eye, or it could be a cranial nerve problem. Yes. So all of these things can cause ptosis from taking place. So you have to go to the eye clinic and go and have your eyes checked. When your case history is being taken, that's when you are asked different questions regarding the condition you are experiencing at that moment. We'll be able to know, okay, exactly what is going on and how it started. It will be pinpointed, and then that case will be addressed. So yes, thank you, Mama Chinyere, for that question. You should go and have your eyes checked at the clinic so we can know exactly what is going on. So the next question is from Tunde from Ikorodu. And Tunde says, Doctor, these days I cannot read my Bible well unless I take it far from my eyes. What is the reason for this? Okay. So, Tunde, I'm guessing you are already in that age bracket of 40 years, maybe 39, 40, 41. So, this condition is called presbyopia. Now, what is presbyopia? I said it earlier, presbyopia is an eye condition that is that comes with aging, where it becomes difficult to read small print or to do near tasks without the aid of your glasses. So you are seeing cases where, like you, Mr. Tunde, you have to take your book or your Bible very far away from you, like far away from you, so you can see it better. You hear some persons say, oh, they have to put on lights to aid their reading, because in dim illumination it gets worse. That's the presbyopia. You have to use bright light to read. Yes, you see cases like that, or you hear things like that. So it's basically presbyopia. All you need to do is go to the eye clinic. Your eyes will be checked, and then you do a glasses test, which is called refraction. You'll be refracted, and then you'll be prescribed your appropriate lenses, so you'll be able to read your Bible better and do near work better. So yes, that's that about presbyopia. So if anybody is experiencing such symptoms where, oh, you cannot read your Bible clearly, or you cannot do anything near you so easily because you are straining your eye, or it's becoming blurry, difficult to read, see, then please just go and have your eyes checked in the clinic so you can get your glasses for those who are in presbyopic age. And then if you are not around that age, 40, 39, maybe you are much younger, then it's still most likely a refractive error. So please go and have your eyes checked as well and get your prescribed glasses. Thank you very much.
All right, then. Once again, Lagos, someone tried calling in earlier, and I'm just hoping the person can call in again so we can have, the concerns the person has. Let's now, before you take the next question, let's look at some of the, we know that fruits and vegetables are quite good, but, in recent time we've been hearing a whole lot as regards to nutrition. It's all over the internet. Oh, this one has sugar, that one has lesser sugar. Oh, beans is carbohydrate now. In the past, when we were growing up, beans used to be protein, but now it is carbohydrate, right? Yeah. Can we re-emphasize, re-echo, the fruits that are nutritious for the eyes?
Okay.
And what they do. Because for some people now, oh, if I eat a lot of carrots, oh, this thing will not happen to me, or it will clear this thing. Let's state it clearly now.
Okay, so basically these foods or fruits or vegetables that you eat for your eye health, they contain what we call eye antioxidants.
Okay.
So they are eye antioxidants, and then these antioxidants, what they do is that they supply your eye with the nutrients and everything necessary for your eye to stay healthy. So that's what it does. And then thank God for God that we have these foods and fruits that we can eat that contains these things naturally. So you have vegetables, your like we call it ugu, your efo, spinach, all these leafy greens. They are very rich in these eye antioxidants. So they supply your eye with the nutrients you need. That's basically it's your vitamin E, your vitamin A, all these things needed for your eye. It is there. Your fish is very, very good for your eye. Your fruits, like your carrots. Carrots is a vegetable, right?
Yes.
Okay, your vegetable like carrots, and then your other fruits, very, very good for your eye. Aside fruits, you also have water. Water doesn't contain eye antioxidants, but then water is very good for your eyes.
Water is life.
Water is basically, water is life. Like 70% of human body is water. So you need water for your eyes to be healthy. For you to be healthy generally, you need to drink water. A lot of persons come into the clinic and then they are filling their pre-test form. If you ask them, oh, do you drink enough water? They'll say less than 1 liter, no, that is very bad. So I encourage everyone today to please drink enough water, and also please eat your fruits and vegetables because they have eye antioxidants good for your eyes. Thank you very much.
Okay, can we take a look at some other questions?
All right, so we have another question from Mr. Bamidele from Festac. and he says, "Good afternoon, doctor. Thank you for always educating us on the program. I see something like flesh growing from the corner of my eye, okay, toward the middle. It is not paining me, but I am worried. What is it, doctor?" Okay, Mr. Bamidele, this is known as pterygium. Pterygium. So pterygium is a fleshy growth that comes usually from the nasal part of the eye. That's from the parts from your nose towards the middle central part of your eye. That's what nasal, nose, that's what nasal means. So it's growing from the nasal part of your eye towards the central part of your eye. It doesn't happen suddenly, but it's something that grows over time. And then this can be as a result of exposure to UV rays. Now, sunlight is one of the, should I call it, risk factors that causes pterygium from taking place. Sunlight, dust, smoke, all of these things that you're exposed to on a
So those who make our smoky jollof, what happens to them?
If you see most of them come to the clinic, maybe if they have any eye condition, they now decide they want to go to the clinic, you will notice that most of them have pterygium. That pterygium is very, very common among
But in this part of the world, we're big on eating smoky jollof. Are there ways they can protect their eyes so we can still, enjoy what we want to eat?
Okay, so usually to shield your eyes from these UV rays and then dust, smoke, you wear your glasses, basically your prescribed glasses. Like your photochromic glasses is going to protect your eyes from UV rays.
Okay.
So your photochromic glasses is doing that work, and then just putting on your glasses normally is going to help you shield your eye from dust and all these foreign bodies that could enter into your eye. For smoke, in a way, but then the smoke is actually in the environment.
In the air.
Yes. So usually it's just to stay away from smoky environment. But what can these people do really?
What can, aside from the fact that we want to have the smoky jollof, we also need to understand that is their own stream of income.
Yes, and then another thing is, if you are doing that, then you should be in a place that is very aerated. So in the open door, yes, open doors, at least the atmosphere, everything is working for your good at that moment, taking away all the excess smoke.
Okay.
Yes, so that's what you can do. Just be in an aerated place.
All right then, Lagos, Nigeria. The program is Eyes on the Road here on Lagos Traffic Radio 96.1 FM. Bring it on. Let's know what your concerns are as it concerns your eyes. 0915-387-7127. The optometrist is in the house. Aderibigbe, Emioluwadamisi is with me in the studio. And, of course, she is more than willing to take you to the classroom this afternoon on all that concerns your eyes.
Okay, so I will take some more questions. We have from Yakubu from Alimosho. Did I get that right?
Yes.
Alimosho. Okay. So Yakubu says, "Good afternoon, doctor. My father is finding it hard to see people's faces well. He says the eyes are not clear again. What can be the problem?" Okay, Mr. Yakubu. So there are different conditions really that can cause one to maybe not see faces clearly or not to see things clearly at a distance. It could be a refractive error. It could be a pathology case. So if it's refractive, then it can be corrected with your prescribed glasses. Your lenses would do justice to that if it's a refractive error. But if it's pathology, then depending on the type of pathology it is, medication, surgery, or whatever it's needed to treat that condition can be done. So what I would recommend is you going to the eye clinic to have or rather taking your dad to the eye clinic to have his eyes checked, so it can be diagnose exactly the condition he's having, and then that can be treated appropriately. It can be refractive error, like I said, maybe myopia, hyperopia, presbyopia, or even the myopia and presbyopia combined, because he's definitely an elderly person, or hyperopia and presbyopia combined, which is one of the things that could cause him not to see faces properly. It could be that he's developing cataracts in his eye. It could be that there is glaucoma taking place. It could be any eye condition really, because I mean, he's already in like aged. He's already aged. So yeah, just go take him to the eye clinic. Let him have his eyes checked, and then it will be decided exactly what or diagnose exactly what condition he's having, and it will be treated accordingly. Thank you very much.
All right, Lagos, let's quickly take one or two more traffic reports before we wrap things up on Eyes on the Road this evening. From Imota, vehicular movement from Sabo Roundabout to Sabo Emioluwadamisi, low-cost housing estates, Jendo, Nasfat, Sawmill to Itamaga. It's a very good one. Itamaga, down to Lucky Fiber, Maya, Adamu to Imota, you have it good. Itamaga, Idiroko, Sele, Baga, Omitore, Leshin, down to Elepe. It's a moving traffic this evening on the return journey from Elepe, Leshin, Omitoro, Baga, Sele, Idiroko, Itamaga. It is all looking very good. Immediately after Demore, Inward Samuel, Nasfa, Jendo, low-cost housing estate, Alaka, Sabo, Nimalu, down to roundabout, it's a moving traffic. Away from there, let's tell you that within Ikeja GRA, it's slightly busy on the service lane from Anthony Inward, Maryland, intersection Orotodo, Yalaru, Obalaji Bank, anyway. Slightly busy along Obaki Jobi Way, the local airport road and Kodeso, inward and outward on routes to the General Hospital and Awolowo Way. Both sides of Aba Akran, the movement is good. En route to local airport and traffic managers are on ground doing the needful. All right then, Dr. Aderibigbe, can we have more questions? We'll take one or two more before we wrap things up.
All right, ma. So we have from Mrs. Ade. She's from Ikeja. And she says, Doctor, they said I have glaucoma, but my eyes are not paining me at all. Can something still be wrong even when there is no pain? Yes, Mrs. Ade, something can still be wrong even if there is no pain. So, first of all, what is glaucoma? Glaucoma is an irreversible eye condition that leads to blindness. That blindness cannot be reversed. That's why it's irreversible, right? So, glaucoma is also called the silent thief of sight. Silent in the sense that you are not going to feel any symptoms. No pain, no headache, no tear, no itch. You are just going to be there moving, and then there is damage going on behind your eye, and you can't see it because it's inside your eye. Now, it's only when you go to the eye clinic that they can examine you and take a look at the back of your eye and know that, oh, there are signs taking place that is suspicious of glaucoma, or your eye pressure is very high, which is one of the risk factors for glaucoma. So yes, ma, it is very, very possible that there is glaucoma taking place, and then you are not feeling any pain, because you really won't. So please, ma, take it very seriously. Go back to your doctor and then let them tell you exactly what you need to do. There are also tests that are done to diagnose glaucoma. So make sure you run this test and then get a confirmed diagnosis, see your doctor, and let them give you the appropriate treatment. Hello, good evening, sir.
Good evening, doctor.
Yes, good evening, sir.
My name is Emioluwadamisi.
Okay, Mr. Olumiwa. Welcome.
Well done.
Yes, sir.
Thanks for the explanations you are making.
Okay, sir. Thank you, sir.
I just want to ask one question, like this issue of glaucoma.
Okay, sir.
At, let's say, over 70, can you still worry the person?
Over 70, can you still worry someone? Is that your question? Okay, yes, sir. Yes, sir, it can. Glaucoma is also like something that the aged persons or aged people have. That's the elderly people. It can also come at their old age. So yes, once you are 70 above, no matter what age you are, even young children, everyone that is having any of these risk factors for glaucoma is prone to having glaucoma. So yes, sir, it can affect somebody that is even 70 years and above.
All right, then, let's see. Can we accommodate one more? I'm sorry, we cannot even do that right now. So, well, as we wrap it up on the show, thank you so much, Elda Tewogbade, for calling in on the program. As we wrap it up this evening, save your side, secure your future, early action prevent frightening situation. As always, go for your check-ups, and most importantly, don't give up any sign or discomfort in your eyes. Stay safe and stay side healthy. If you missed any part of today's show or previous edition, you can always catch up on our Facebook page and YouTube channel. That's at Lagos Traffic 96.1 FM. Search with the keywords Eyes on the Road. All right, Dr. Priscilla Imade, OD, MSc, PhD in Public Health, is a consultant optometrist at Modern Eye Foundation and a fellow of both the American Academy of Optometry and Nigerian Optometrist Association. Today's edition of the program has, we have featured Dr. Aderibigbe Emioluwadamisi rather. She's an optometrist at Modern Eye Foundation also. For inquiries, you can contact both 1618 Ogunosi Road opposite Omoli, Estate Phase 1 by Akiode, Pastor Pojodu Beja, Lagos, or call 0803 333 6672. Thank you so much, Dr. Emioluwadamisi. All right, on behalf of our production team led by Micah Rocha with assistance from Bakari Kausara, our executive producer is Tayo Akoli. I am Taiwo Barua. Eyes on the road, your safety, our priority. Lagos Traffic Radio. See you next week.